Okay, let's talk about a sound that is honestly terrifying for any parent to hear. That sudden, harsh, barking cough coming from your child's room in the middle of the night. Today, we're going to figure out what that sound is, and more importantly, what to do about it. We're talking about croup. So you hear your kid coughing, right? But this sounds totally different. It's alarming. It's not the kind of cough you're used to from a regular cold. So the big question is, how do you know if this is something you really need to worry about? Well, sometimes that sound is exactly what you think it is, a critical warning sign. That very distinct cough is often the first sign of croup, and it's a condition that really does need your immediate attention, especially when we're talking about little kids. All right, section 1, the scary cough, identifying the telltale signs. So, what exactly are we listening for? What makes this cough so different from a regular old cold? Let's break it down. Okay, so there are two classic signs you absolutely need to know. The first is that super harsh barking cough. People say it sounds like a seal, and honestly, that's a pretty good description. The second is a high-pitched whistling sound called stridor. You hear it when your child breathes in. And you might notice these symptoms just pop up out of nowhere, and they almost always get worse at night. That's because the cool, dry air can irritate their airway even more. Okay, next up, why is it dangerous? Understanding the risk to young children. So this is the really important part. Why is croup so much more concerning for kids than it would be for an adult? It really just comes down to basic anatomy. So what is croup? At its core, it's just swelling of the voice box and the windpipe. It's almost always caused by a virus, and it's super common in kids between 6 months and 5 years old. And while, yeah, an adult can get it, the danger for a child is on a whole different level. And this image here shows you exactly why. Look at the healthy airway on the left. It's wide open, plenty of room for air. Now look at the one on the right. That's what happens with croup. A child's airway is already incredibly small. Think about the width of a drinking straw. So when that tiny passage starts to swell up, it can get dangerously narrow really, really fast. And that's what makes breathing so difficult. And this is where we get into the serious consequences. If that swelling isn't managed, it can lead to severe breathing problems, what doctors call respiratory distress. Plus, when your child's body is working so hard to fight off that initial virus, it can make them vulnerable to other things, like pneumonia or nasty ear infections. All right, section 3, differentiating severity. Mild, moderate, or severe. This is super important because knowing how to gauge the situation helps you decide what to do next. Generally, croup falls into one of 3 buckets. Now, the good news is most cases of croup are mild. The single most important thing to listen for is the stridor, that noisy breathing. Ask yourself this question. Can I only hear it when my child is crying or really worked up? Or can I hear it even when they're calm and just resting? If you can hear that stridor when they're at rest, that's a huge sign that things are getting more serious and you need to pay closer attention. Okay, so what if it is just a mild case? Let's talk about home care. What to do for mild cases. The great thing is, for most kids, you can handle this at home with a few simple but very effective steps. Okay, listen up, because this first one is the absolute #1 priority. You have to keep your child calm. The more they cry and get agitated, the worse the swelling gets and the harder it is for them to breathe. So comforting and soothing them is literally a form of treatment. Your calm becomes a medical tool in this situation. After that, moisture is your friend. Think steam from a hot shower or a cool mist humidifier. And of course, keep them hydrated with fluids. Have them sit upright to make breathing easier, and you can use paracetamol if a fever is making them uncomfortable. Next up, how to prevent croup. Now, obviously you can't lock your child in a bubble, but there are some really practical, effective ways to lower their risk of catching the viruses that cause croup in the first place. And honestly, it all comes down to the basics we already know. We're talking frequent hand washing, trying to avoid people who are obviously sick with a respiratory infection, and just boosting their immune system with a healthy diet. Also, staying up to date on vaccines and avoiding irritants like smoke. It all helps build a better defense. Okay, we've arrived at what is maybe the most critical part of this entire discussion: when to seek emergency care. Knowing these red flags, knowing when to stop what you're doing and go straight to the hospital, this can literally be life-saving. And you have to understand, with severe cases, things can get worse very, very quickly. You just can't afford to wait and see if you're noticing major signs of distress. A child's condition can deteriorate fast if it's not treated. So please, pay very close attention to these signs. If your child is visibly struggling to breathe. If you hear that high-pitched stridor even when they are resting. If you see the skin pulling in around their ribs or their neck with each breath, that's called retractions. Or, and this is a big one, if you see any bluish or grayish color around their nose, mouth, or fingernails, these are absolute emergencies. Same goes for drooling, difficulty swallowing, or if they're extremely agitated or unusually sleepy. As a parent, you have to trust your gut. If it feels wrong, it probably is. So, are you prepared to act when you hear that cough? Understanding these signs is like your superpower in this situation. It lets you trade that feeling of panic for a clear plan. It empowers you to stay calm, to assess what's happening, and to act decisively to protect your child. So next time you hear that cough, you'll know exactly what to do.
Health is the most precious gift. If this video helped you or someone you love, please like, subscribe, and share so more families can stay safe and healthy.